Hello everyone. In the 6th week of the 12-week certificate course on palliative care with integrative approach, we are going to talk about symptom management again. In this week, mainly our focus will be the spinal cord compression management, respiratory disorder management, chronic obstructive pulmonary disorder, COPD. COPD is an irreversible change where there is a fibrosis in the respiratory tract, in the lung part, the trachea. So the normal physiology of respiratory tract is disturbed. So that patient has a lot of problem. So what are the symptoms and how they can be managed? What is left over that should be fully efficiently used for the body. That is our goal. We are not going to reverse the COPD fibrosis, but what is left over, that is the full efficiency utilization will be talked about in this. And superior vena cava syndrome and gastrointestinal symptoms in palliative care and diarrhea management in palliative. In spinal cord compression, early recognition prevents neurological damage. In this case, the integrative care by steroids, Ayurvedic drugs, Ayurvedic procedures, and physiotherapy can be combined together. And how it is going to be effective in patient, that part will be discussed. Lifestyle and dietary support also will be discussed. In case of the respiratory disorder, we are going to talk about the dyspnea, cough, death rattle, and hemoptysis. In this, medical and Ayurvedic management in combination as a supportive medicine to each other will be discussed in detail, and yoga and breathing techniques will also be touched upon. In the supravena cava syndrome, we will discuss the emergency symptoms in thoracic malignancies, allopathic drug like steroid and stenting will be discussed, and Ayurvedic drugs like Arjuna, Punarnava, Panchakarma therapies will be discussed. Specifically, the topics, the title of the topics which will be discussed in this week are the spinal cord compression management in palliative care, introduction to respiratory disorder, part 1, the symptoms of respiratory disorders in palliative care, part 2, chronic obstructive pulmonary disorder, COPD, supravena cava syndrome management in palliative care, and gastrointestinal symptoms in palliative care, and diarrhea management in palliative care. So friends, let us begin with 6th week of learning. Thank you very much.